The gentlelady from North Carolina, the distinguished ranking member of the committee, Dr. Foxx.
Thank you, Mr. Chairman. Mr. Secretary, I hope your answers to my questions will be a little more complete than your responses from last year. I've asked you this question several times, and I expect a substantive response today. And as you know, we're going very quickly through this hearing if we can, so I'd appreciate succinct answers. The statute authorizing the FDA's temporary emergency use authorizations for COVID-19 vaccines include a provision that individuals must be informed, quote, of the option to accept or refuse administration of the product, of the consequences, if any, of refusing administration of the product, and of the alternatives to the product that are available, and of their benefits and risk, end quote. That's in the statute. Would allowing states' public officials in schools to mandate vaccinations violate the statute, which allows the patient the option to refuse? Yes or no?
Congresswoman, are you asking if the mandates, any requirements would be imposed by states, or if those are legal, or if any requirements imposed by the federal?
Do they violate the statute?
If you're speaking about any requirements by state or local governments, I'm not going to try to venture into saying what they did and whether under their laws they are legal. I can tell you what we did at the federal level.
Does it violate the federal statute? Yes or no?
Congresswoman, I'm trying to respond to you. If you're asking me about state law, I don't represent a particular state. I represent the federal
I understand.
government.
That's why I'm asking you the question. You represent the federal government. Can the states pass a law that contradicts federal law?
The states can pass laws where they have jurisdiction. If there is a conflict, then the courts will decide if there is a ability for the state to enact laws.
So you're saying the federal government had no jurisdiction to pass this law?
No, that's not what I'm saying.
Okay. I'm going on to my second question. The recent proposed rule on benefits and payments makes gender transition procedures an essential health benefit offered by all exchange plans. The proposed rule could force some medical professionals to violate their expertise or beliefs on the best care plan for individuals, particularly children, seeking gender transition medical services. Your administration continues to double down on this policy by clearly targeting states like Texas, which seek to protect minors from life-altering and irreversible surgeries and unnecessary treatments. What safe harbors are included in the proposed rule for religious providers or other entities that have objections to administering gender transition treatments and surgeries on minors?
Congressman, one of my duties and one of my former duties as the Attorney General in my state of California was to not only enforce the law, but to comply with the law. As Secretary, that's what I'm doing now. I'm not only complying with the law, but enforcing the law. If someone remains within the confines of the law, there can be no action taken against them. We certainly, when it comes to Americans' rights, whether you're transgender or not, we will enforce your rights to be protected. And we will do everything we can for the transgender community, especially our youth, to know that they will have their rights protected.
Well, you're not answering the question, so let me go on to my third question. So you don't answer the questions on the safe harbor. So we thank you for the administration's work to implement the No Surprises Act, which was intended to put an end to an exorbitant charges from out-of-network healthcare providers and to begin lowering costs for families. Unfortunately, litigation has caused a delay in the implementation of this important law. You have said the administration will issue revised rules in May. Can you commit to that timeline to ensure certainty in the healthcare marketplace? In the revised rule, will you commit to implementing the law in a way that limits overuse and abuse of the arbitration system and does not drive inflation in healthcare costs?
Congresswoman, first, thank you very much for the support that Congress gave for this No Surprises Act law, which we are now implementing. We will make sure that what we put out is something that helps us avoid the costly process of arbitration. We think we have rules that will be in place that will not only help avoid that type of litigation, but will protect the rights of individual patients to not be blindsided by these bills that they get after they've left the hospital or medical center. And so we will work with you where we can to improve the law, and we will implement based on what you provided us in statutory instructions.
Well, this is a purely bipartisan issue. The chairman and I worked hard on it, and we'd like to see it implemented appropriately. Thank you, Mr. Chairman.